Hi, I'm Bryn Zolty. I'm a pelvic floor physical therapist.
I'm Becca Ironside, and I'm also a pelvic floor physical therapist.
Together, we've developed a program targeting men going through prostate cancer treatments. I'll be focusing on urinary leakage.
And I'll be focusing on erectile dysfunction. We hope you enjoy this series of short videos. They will help you see the role that a pelvic floor physical therapist can play after a diagnosis of prostate cancer.
Urinary incontinence is defined as the involuntary loss of urine. If you look up urinary incontinence prevalence post-prostatectomy, it ranges anywhere from 4% to 40%. And that great range in number comes from how they define urinary incontinence. It can be based on the amount of urinary leakage or the timeline of the urinary leakage. But in general, any loss of urine post-prostatectomy, the rates are closer to 40%. Ideally, we would see all of our men pre-operatively. We would discuss strength training, bladder health, things to do and things to avoid. And that way you could begin your program immediately after the catheter is removed and your physician says it's okay to start performing your program. The British Journal of Urology published strong research to suggest that even one pre-op visit, followed by post-op visits, and then once monthly, showed a statistically significant improvement in symptoms in men over this normal standard of care. Whether you can come to physical therapy preoperatively or postoperatively, a key focus is on your strengthening program. Research shows higher rates of being dry at 3 months for men who are performing physical therapy, including a Kegel program, as opposed to men who are not. So the first thing we need to know is, do you know how to contract your pelvic floor? And a lot of times I see men activating their abdomen and squeezing down strongly, actually putting pressure on the pelvic floor instead of contracting up in, or turning on muscles in the legs and the gluteal muscles. Verbal cueing alone has not been shown to be effective in teaching how to do a Kegel. In fact, almost half of people verbally cued on how to do a Kegel perform them incorrectly. So when you come to physical therapy, we can observe the muscle contractions, we can feel for the muscle contractions, and most often our most effective way of teaching a pelvic floor contraction is with the biofeedback. And the biofeedback, we use electrodes on the outside of the body over the pelvic floor, and then you can observe the contractions on the computer screen to help you visually learn how to perform the contractions correctly. Here is an example. The pelvic floor activity is seen in the green line, and the abdominal activity is the blue line. Here is a patient performing an endurance contraction of their pelvic floor, followed by some quicker contractions of their pelvic floor. Each program is made specifically for that individual, based on how long you can hold your contractions, the strength of your contractions, and if you're using those other muscles. We teach you pelvic floor contractions in still positions and with dynamic motions, and we focus on coordination of the breath and the contraction with activity. So the next big thing we focus on is pressure management. We really want to avoid pushing or bearing down on the pelvic floor. The more you push or bear down, as with breath holding, most commonly with sit to stand, with rolling over in bed, with lifting an object, the more work and more pressure you're putting on the pelvic floor, and the more likely you are to have leaking. So we can look at how you do a task, whatever task it is during your day that causes you leaking, and we can work you through the movement of the task. We'll time your breathing, we'll time when you should activate your pelvic floor, and those are all related to coordination. And usually within a single visit, we can have that activity result in no leaking. Strength training takes months and takes a lot of time, but coordination, you can start to see results very quickly. Another important aspect of coordination of the pelvic floor for men is that some men achieve a lot of their urinary continence from their prostate. The prostate has the ability to stop the flow of urine, as when a man ejaculates, it prevents urine from coming out. So when the prostate is removed, this can lead to increased leakage if that was their primary way of staying dry. So we need to teach them the coordination to activate the pelvic floor and their urethral sphincter to help them achieve continence. Another key point in your pelvic rehab post-prostatectomy is bladder training. Bladder training includes education on what's normal bladder health, irritants, schedules, fluid intake, and this is all very important because when you're leaking urine, the tendency is to drink less fluid and pee more often because if the bladder's empty, you're less likely to leak urine. However, the bladder starts to fill less before it starts to give you an urge to urinate, and then you start peeing all the time and your bladder is not holding as much as it could. So your muscles get stronger and you're able to be more continent and you're still peeing very frequently. And this can even lead to urge incontinence. And there's research showing that when provided bladder education, people had great improvements of symptoms even as early as 8 weeks. Another topic we touch on is core strength. So anything we find on the evaluation, and usually that involves looking at your core strength, we can provide you with exercises to help strengthen and correct. Usually weakened core strength leads you to holding your breath and using momentum for movement, and that leads to leaking. So we want to make sure we address that. Your pelvic floor is a core muscle, and we would work that into all of your exercises.